joining us with reaction to the president's address and for the very latest analysis on the coronavirus threat. Dr. Mark Siegel with us, our medical A team, and Nicole Sapphire, also part of our medical A team, and former White House physician, Dr. Ronny Jackson, is with us. Good to see you all. Dr. Jackson, let me start with you. Yes, we've never seen anybody ever put a ban in effect more quickly. We never have witnessed a quarantine this quickly. I don't think we could ever really calculate in any way how many people probably did not get the virus as a result of those quick actions. Let's talk specifically for those Americans that are fearful, because I think just getting truth to people is important. Perspective is important. I don't think most people, for example, know tens of thousands of Americans yearly die just from influenza, the average flu virus. I don't think most Americans know that when we faced a pandemic known as swine flu, H1N1, 2009 and 10, within a year, 12,500 Americans died and tens of thousands had contracted that disease in a year. We ended up worldwide losing, according to some estimates, well over 500,000 people worldwide. We're not seeing those numbers here, but out of an abundance of caution, the president has taken even more unprecedented steps. Your reaction, big picture, talk to the people at home, bring in your medical expertise, and tell people what they need to know.
Well, I can tell you, Sean, just to start with, you're right. This is not the first time that we've been tested with something like this. And I watched the president tonight, and I'll tell you that, that's what leadership looks like. And the president, his leadership on this didn't start when we found out about this. I've been at the White House, with him for the last 3 years. We've had a robust pandemic planning team in place since his administration started, led by the national security staff. We've had infectious disease experts and other physicians that are on that team. And as soon as something comes up like this new novel coronavirus, everything goes into action on what we're going to do for this. And the president's been quick, he's been decisive, he's reacted appropriately according to what the situation dictated, and he has saved lives in this country, and he has kept the spread of this from getting out of control. And we can see what happens when it.
What are we seeing, especially those that might contract this virus, feel very fearful about contracting the virus? What would you say if you are otherwise healthy, with no other underlying health issues, if you don't have a compromised immune system in any way? Tell us what will likely happen to you. What are the odds?
Well, first off, the likelihood that you're going to actually contract the virus is pretty small, very small, right? And I think, if you fit into the category you just described, where you're otherwise healthy, young and healthy, you go on about your life for the most part. Now, you need to be a little bit more cautious, maybe about washing your hands and using hand sanitizer, things of that nature, covering your cough. But those are things we should do anyways when we're in cold and flu season.
If you're healthy with no underlying health issues and you don't have a compromised immune system, odds are pretty strong you're going to be healthy.
There's a good chance. There's a good chance you're not even going. Well, there's a good chance you're not even going to know that you have it, right? Some people are going to be completely asymptomatic, and they're going to go on and develop some type of immunity to it. Some people are going to get it and get mild symptoms like a cold or a mild flu or whatever, and they're going to recover completely from it. That's going to be the vast majority of the young, healthy folks. It's really the elderly, the really elderly people that need to take these extra precautions. But, I think that...
Oh, I'm sorry. Go ahead. Finish your thoughts, sir.
No, I was just saying, I think that we're doing everything that we need to do right now as a nation. I think we're going above and beyond. I heard you talking earlier, and, it's a shame that this was, used as a political tool early on. I hope we're getting past that now. I feel like maybe we are. But I think the president's doing everything he needs to and everything he can to keep our country safe. And I think people need to not worry. This is going to be okay.